Our next presenter is Wangari. I know we have Dr. Lawrence here as well, assessing the potential impact of the meningitis vaccine. Do we have Wangari online?
Yes, I am online. So we are assessing the potential impact of the new meningitis vaccine that will be rolling from the next year in Nigeria. And this is an agent-based model. And I did this piece of work with Steve, Samuel, Lawrence, Emily, and Nafiu. 3 of my group members are there with you. Yeah, we can go to the next slide. So basically, this disease is mostly common into this place that you can see that the map that the dotted areas in that map, whereby it is the area that is mostly high because of the seasonality effect of that area. And that has been an area in Africa where the disease has been having a lot of impact. And that's why we decided to start with a small part of the area, which is Nigeria. And then after getting to understand every impact that gets to happen in Nigeria, then we'll now get ahead to think about of the whole entire picture and also any other factors that are contributing to the whole entire picture. So something to note about this model is that whatever piece of work we are doing here, we have not considered what if we do vaccination in Nigeria and Cameroon has not done their vaccination, what will be the impact? You're just thinking of Nigeria alone as a country. And then after we start advancing is now what we will be thinking of what other countries will be doing or what other perspective can be happening. Yeah, we can go to the next slide. So meningitis is a bacteria transmitted via respiratory droplets, either through coughing, sneezing, or even close contact when you're in an overcrowded environment. And these overcrowded environments can be the schools, hospital, places where people work and markets, and such things are things that you cannot get into control with. And one of the big limitation of this model is that we could not get the contact, the amount of contact or the contact transmission between people in Nigeria. So that's something we used as an assumption for this model. So the key factors that we use affecting meningitis spread includes the population density, vaccination rates, and climatic factors. The seasonality of this disease, seasonality is one of the main aspects that accelerates the disease. So during the dry season, the rate at which meningitis is spreading in the area is quite high compared to the time which is not dry. So seasonality is a big aspect, part of it. The vaccination rate is also a big aspect because if we get to vaccinate a good number of people, it means that then we get to reduce the susceptible people who are susceptible in getting meningitis and also get to reduce the transmission rate. And when you come to the population density, it's because you can also not try to show how, the contact transmission rate and how someone is trying to contact from one person to the other person. And that's basically it. The next slide. So the research gaps in this study is that despite having a lot of work being done on research about meningitis, we're still having reoccurring meningitis outbreaks in Nigeria. And there has been current ongoing efforts on vaccination happening in that country. And also people have also come up with models like compartmental model, trying to show us how we can try to eliminate this disease, but it's still happening. So that's what was one of the things that made us go ahead and work on this disease. The other thing that also made us go ahead and work on this disease is that the current models that are there are more about compartmental modelings. And when you think about compartmental models, they are models that assume homogeneous mixing of individuals, and not even that, they don't really get into see an individual behavior like an agent. We get to see one person, how they get to move from one end to another end. So that's also why another reason we decided to do that piece of work. And lastly, we also decided to do this piece of work because of the social factors and also the environmental factors. In other models that are existing, maybe you can fail to integrate components like the seasonality part of this disease, and that's what led us to now trying and starting doing this work with ABM. Yeah, next slide. Objective of this study was to estimate the proportion of population or subgroups that should be vaccinated for us to achieve herd immunity for the meningitis in Nigeria by 2030. And also the other specific research question was how different is this new vaccine coverage will impact the overall transmission dynamics of meningitis. And other is what is the threshold for achieving herd immunity in Nigeria by 2030. So basically, the new vaccine that will be rolled out by the WHO will start being rolled out next year. So we were just trying to see if this vaccine will be rolled out next year. Now, for the 5 years that are left for us to achieve the Vision 2030, what is the probability? Just trying to see the picture. How many cases are we going to avert? And it is through it's through vaccinating which type of age group or not. And also this new vaccine is that this new vaccine will be targeting all the serogroups of meningitis, because the current vaccine only targets one serogroup of this meningitis. Yeah, next slide. So basically with meningitis, the model structure with meningitis is someone you are susceptible. If you're in a population where meningitis is happening, then you are susceptible. That's where you go into the place where we are saying susceptible. And then when you come into contact with someone who is infected, you will get the disease. So if you get the disease, we call it colonization, which can be either infection. And if you get the infection, the disease, you can either progress to the disease, get the meningitis, either die or go and recover. If it's not that, when you get the disease through colonization, you can recover without us seeing the progression part of it. Now, this one is the part where we call it asymptomatic meningitis, which is a very it's where someone has meningitis, they can't spread the meningitis, but they don't seem to be knowing that they have meningitis. And these are the people called carriers. And these carriers are the people who tend to make the spread of meningitis more and tend to accelerate the meningitis spread, because when someone is a carrier, they don't basically know that they have the disease. So even trying to take the control measures of the disease is kind of low. And then you can either recover, gain the immunity, and then your immunity can wane. And then you go back to susceptible. Next slide.
Okay, I switched it, but Wangari, you're at time. So maybe give us your one snippet of results and maybe some ideas of next steps.
Okay, just go to, because I've already talked about these methods, you can go to the next slide. Oh, cool. Okay, another next slide, because I've also talked about this one. Next slide, where we have graphs. Yeah, so basically this is what is happening, and this is how the disease is currently. And we just basically the prevalence, new infection, and also cumulative infection. And on the next slide, we're seeing how we did model to see on the next slide. Yeah, we did model to see if we did get to vaccinate the whole population, how the disease will turn out. This is the first the first side of it. And when we did only vaccinate the age group between 9 to 18 months, how it will turn out to be. So basically the main message of this piece of work is that saying when we vaccinate a whole population, we can see that you are averting more cases rather than just specifying ourselves to a certain target population of 9 to 18 months. Because when you look at the whole population, you can see we have averted many cases. So basically, that's the main message from this whole piece of work. Yeah. Next slide. I think the slides are over. Yeah, basically, I've already done the discussion and limitation. I did talk about them. So, yeah, thank you for listening. I'll be happy to take any questions.
My telltale of like your time is up doesn't work virtually. So thanks for playing along, Wangari. Okay, any burning question for this meningitis? Yeah, go ahead.
Yeah, thank you very much. That's a good work. I I have a comment on your one of the underlying rationale for this study. You mentioned that previous studies did not really consider the impact of seasonality in meningitis modeling. But I just want to, as a suggestion, point out that there is this work, previously some of these studies have really looked at that. So Tom et al., we can look at that work, and then Carhaio 2015, they did a study that included that. So we can look at that as a way of, you can look at that as something to maybe to consider later. And also, given that meningitis is, it has this age burden dynamics, do you plan to include that in your model for future study as part of your future plans? Yeah.
Thank you for your questions, and also thank you for the input that we can go back and read that paper from Tom et al. 2015. Yeah, we are thinking about the aspect of the age of the disease, but basically the broader picture of it is that we can never do an elimination if we only target a certain specific age group. So first, you're thinking about eliminating. If we want to think about eliminating the disease, we thought about going with the whole entire population. But yes, we understand that it has a certain burden to a certain specific age group. So thank you.
Great, thanks for your question.